In 1934, a middle-aged man named William Chester walked into a hospital for what he believed would be a routine evaluation, and found himself trapped inside a system he couldn't escape. At the time, mental health was governed by broad, subjective rules that gave institutions enormous power. In many cities across the United States, hospitals were overcrowded, underfunded, and desperate for quick solutions. Society believed that emotional distress or unusual behavior could justify long-term confinement, even without clear evidence. William was a 42-year-old clerk who had been struggling with exhaustion and anxiety after losing his job during the Great Depression. His family, worried but unsure how to help, encouraged him to visit a local hospital for rest and evaluation. When he arrived, doctors interpreted his stress as a sign of deeper instability. They believed that early intervention could prevent future problems, a common belief of the era. Within hours, William was transferred to a long-term ward for observation. The staff thought they were acting responsibly, following the medical standards of the time. But the system around them lacked oversight, and once admitted, patients had little control over their own fate. Days turned into weeks. William repeatedly asked to go home, insisting he was simply overwhelmed, not ill. But the hospital's policies allowed doctors to extend his stay indefinitely if they believed it was in the patient's best interest. By the time his family realized what had happened, the paperwork had already been filed. William remained institutionalized for years, not because of a crime, not because of danger, but because of a system that prioritized caution over autonomy. Years later, investigations into similar cases revealed that many adults had been institutionalized under vague or outdated criteria. These findings forced lawmakers to rewrite patient rights laws, introduce stricter admission standards, and require clear evidence before long-term confinement. And William's story was only one of many, reminders of how easily adults could be swept into systems that were never designed to protect their freedom.